Welcome back. It's 9/22. Very important month for men all over San Antonio and South Texas and all over the country for that fact, because 1 in 8 men will be diagnosed with prostate cancer during his lifetime. It is one of the most common cancers among men. Since September is National Prostate Cancer Awareness Month, it's time to review the warning signs you're going to look for and know when to get screened. So joining us live this morning is Dr. Christien Kluwe. He is a radiation oncologist with UT San Antonio, an MD Anderson Cancer Center. And we want to wish you a very good morning, doctor, and thank you for being with us this morning.
Awesome. Thanks for having me on.
First off, let's just start talking about prostate cancer. What are the signs and symptoms men need to start looking for?
Well, unfortunately, the signs and symptoms of prostate cancer are kind of familiar to guys as they get older in general, right? So you start noticing maybe some urinary problems, some difficulty starting, maybe getting up frequently at night to go to the bathroom. You can also notice things like pain in the bones and whatnot. And so all this is going to sound really familiar just in general as you get older. So that's why sometimes really prostate cancer can somewhat be silent and why there's such a emphasis on screening of things. Now, we do have some alarming symptoms that really kind of escalate when somebody needs workup. And that would be stuff like blood in the urine or pain in odd parts of the body and in the bones where you wouldn't expect arthritis, so to speak.
So if you feel some of those risk factors, that might be an indication that you want to get tested?
I think, as you get older and you start feeling those risk factors, if you have not had baseline testing for prostate cancer, or screening rather, that you might want to consider discussing with your physician.
How is it detected or diagnosed?
Well, so the most common way we find these things actually is with a regular screening test. So the PSA screening test is just a blood test, right? From guys that look like they have a high risk of harboring prostate cancer, we then go to more invasive tests. So we start looking at doing an ultrasound, maybe an MRI, and then if we really think there's a high chance of things, we go ahead and do a biopsy and get that confirmation.
And you've talked about some of the things that might be factors, but when should men get tested for prostate cancer? I know we're always told to get those colonoscopies at a certain age, but this is a completely different kind of test, looking at a completely different part of the body. So what is the difference and when should we get these?
Yeah, so I generally look at guys, and most guys should start getting maybe a baseline PSA in their 40s somewhere. So guys that are a little bit higher risk than other men, I suggest a baseline PSA around the age of 40. Guys are a more nominal risk, maybe around the age of 50 or so. But then getting a screening PSA every couple of years. Now, you're right. We also suggest that guys get colonoscopies and whatnot, and women too, really. But the PSA screening test is a little bit different in that it's really just a blood test. So it's not as invasive as a colonoscopy as anybody that's experienced with it can tell you and how much they had to prep for the colonoscopy. The PSA screening test is really just a normal blood test that you would get with your normal labs.
And some of the latest treatments, if for some reason we end up with this cancer, what can we look forward to is to hopefully heal ourselves?
Yeah. No, the last 10 years have actually been a really exciting time in coming up with new options for men that have been diagnosed with prostate cancer. We've seen the rise of things like the robotic assisted prostatectomies, in which guys can really bounce back from surgery very quickly because it's so minimally invasive. On the radiation therapy side of things, we've come up with shorter radiation courses, going from our standard 9 weeks down to as few as 5 days of radiation therapy. And then for any kind of systemic involvement of disease, we have a lot more options in terms of how we can fight this thing.
Do you have a recommendation for men as far as getting physicals every year? What year should a man start getting those physicals and start really getting concerned about these kind of cancers and diseases later on in life?
Yeah, it's men are always a little bit challenging. I say that from my own personal perspective as well, right? So we generally don't look into going and seeing a primary care physician until we start actually developing problems, and I'm guilty of that as well. It's we should really think about maybe seeing a primary care physician just once a year, just to kind of touch base and get a baseline expectation of things. And that's the idea too with that baseline PSA. So that then as we kind of monitor things, we can see how have our symptoms changed? Have things changed in a way that suggests, yeah, this is a normal part of aging, or if things change in a way that suggests there might be something else going on. So I really think maybe men at the age of 40 or so should start thinking about this stuff and start integrating a primary care physician into their lives.
Great advice, doctor. Great insight. Thank you very much for joining us this morning. Once again, Dr. Christien Kluwe with UT Health. So we need to get some appointments with our doctors, and we need to start looking out for these things and start taking care of ourselves. Thank you very much, doctor. Appreciate your time.
Thanks so much for having me on.
All right.
Take care, guys.
All right.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.